Please welcome our next guest, Emily Benoit, the speech-language pathologist here at Novant Health Brunswick Medical Center. Emily,
Hi.
so nice to see you again.
Good to see you too.
Yeah, I'm really happy that you're here. And so I wanted to talk a little bit about how you become a speech pathologist. Talk about your training and the process to get there.
So you have to get your master's degree. We haven't switched to the doctorate yet, like OT or PT has. So I did 4 years of undergrad and then 2 years of my master's program. And then following my master's program, we have to do what's called a clinical fellowship year. Oh. And that's a 9-month fellowship. You work a full-time job, but you're being supervised by another speech pathologist during that time.
Oh. You look too young to have done all that already.
Yeah. Good genes, I guess.
Good genes. That's what I say. Were you always interested in this field, or did something happen that drew you to that?
So my mom is a nurse, and so I knew I always wanted to go into healthcare, and I had considered nursing, but I thought about it when I got to high school, and I was like, I don't know if I can handle like death all the time, and which is really ironic given what I do now. Yeah. I always knew I wanted to go into healthcare, and I love psychology. And so when I got to my undergrad, I took a Intro to Communication Disorders class, and I liked it, and I stuck with it. So,
So tell me, who all benefits from speech services? I know it's pretty varied, but you provide it for all sorts of different maladies. So,
Yep. So we serve people across the lifespan. We see, not at this hospital, but somewhere like New Hanover where they have a NICU. You can see babies in the NICU, helping them with swallowing, sucking. We do, toddlers, early intervention age, school age children. We do the geriatric population. We help people at end of life. We work in a variety of settings, so schools, private practices, obviously the hospital setting, skilled nursing, home health. So it's a very varied profession.
So you do see pediatrics then. So what would the teens and pediatrics benefit from? Mostly from a speech perspective, or of course when they're babies, the sucking and the
Yep. So again, like children that are in the NICU, that sucking, swallowing. Some children can benefit if they're like a picky eater. Sometimes we see that with autism. Some kids who have various disorders they might be born with, they might have trouble swallowing. We also service children who might not be able to say certain sounds, so we call that an articulation disorder. The classic one everyone tells me is like, oh, so like when my kid says wabbit instead of rabbit, that's an example of one. Children who are delayed in their talking, children that stutter, those are kind of the big ones we typically see.
I think I have a grandchild that needs to see you.
Probably. It wouldn't surprise me.
He's 5, and some of the words they're not coming out right.
Yeah.
So talk to me about swallowing tests. I understand there's a new method,
so there are 2 major swallowing tests that speech pathologists do. One is called a modified barium swallow study. So that's one we've been doing here forever.
Yeah, I've had that one.
Yeah. Most people aren't a fan of it.
No.
But it is really easy. The patient comes in, we give them different consistencies, different foods, liquids, and essentially take an x-ray video. Takes maybe like 5 to 7 minutes. The other test we are working on starting a program for is called a FEES, so it's a fiber optic endoscopic evaluation of swallowing.
Wow.
Big word.
Big word.
But essentially what happens is we scope the patient through their nose, so we send the camera down and it hangs out right above the vocal folds and the trachea, and we give them different consistencies and see how their swallowing is. It's really nice because you have the flexibility to give multiple trials because you're not under radiation, and then also if we have patients in the ICU with all the equipment, we don't have to bring them down to radiology. So
that's interesting.
Yeah, it's really cool.
I understand that you have a voice therapy approach for patients with Parkinson's disease. Tell me a little bit about that.
So our outpatient facility was awarded a grant through the Parkinson's Voice Project. So that is for a specific Parkinson's voice therapy called Speak Out. So the patient would come in for 12 to 16 sessions, depending on how much support they need. Maybe 3 to 4 times a week, sometimes twice a week, it just depends. And after they complete that program, they join what's called a Loud Crowd. So the Loud Crowd is basically a built-in support group for people with Parkinson's who've gone through the program, and we practice the exercises together. So it helps keep those skills up and kind of helps hold people accountable, which is really important with Parkinson's.
Talking about holding people accountable, once they're discharged from the hospital, or if they're not in therapy like every day in their home, are there methods that they can keep up that therapy at home on their own?
Yep. We actually want everyone who's in speech therapy to be doing our recommendations or our strategies or exercises at home every day. Because that's really the only way things are going to change. So you have to do it every day.
It's kind of like physical therapy. You have to do it at
exactly.
home.
Yep.
How about referrals? Do patients need a provider referral for speech therapy?
That would be my recommendation. Yeah, typically we see a provider referral, and it's also good so they can follow your care. Sometimes I have to ask providers for, a PCP might refer a patient, and I'm like, hey, actually I think they really could use a neuro consult or an ENT consult. So having them involved is really important so they know what's going on.
Yeah, absolutely. So I was going to ask you if there's much difference between the therapy that's provided in the hospital versus what's provided in the outpatient setting. Is there a lot of difference, really?
Yeah, I would say there's a pretty significant difference since I've worked in both settings. I kind of think the acute care setting is you're coming in, something has happened, something has changed, and we kind of want to stabilize you at the acute care level and get you to the next level of care for where you need to go. So my role typically is more of an evaluation diagnostic role. So seeing what's wrong, identifying a problem, doing those evaluations, and then kind of giving the next person who's going to be treating the patient an idea of what's going on. We also do a lot of end of life and more critically ill patients at the acute care level, which you're not doing at outpatient.
Right.
So outpatient tends to be more rehabilitative, maintaining skills, developing strategies, learning new skills like in pediatrics. So very different but overlapping things that we do.
Are there many misconceptions about speech therapy, and can you share those with me?
Absolutely. I think the biggest one that I always get is that no one knows what I do. So I'm like, hey, I'm Emily, I'm a speech pathologist, and they're like, what is that? So just having more people aware of what my role is and how important it is, I think that's the biggest takeaway, I would say. So.
Well, you sound like a busy young lady, and it sounds like you enjoy your job.
Yes, I love my job. I have the best job in the world. I get to see and do amazing things every day. I had, for example, a woman this week who was able to eat solid food for the first time in 2 years, and I got to give her that news. So, I've had,
wow, that's amazing.
Yeah, I've had people talk for the first time after being intubated with COVID for months. It's amazing.
Wow, that's amazing.
Yeah.
Well, thank you so much for coming today. Our time is short, and but I'd love to have you back.
Yeah.
That's a great topic.
Yeah.
And like you say, we need more information out there.
Absolutely. Thank you so much for having me.
You're quite welcome.